Jonas, can I hand over to you?
Thank you very much. Yeah, I'm Jonas. I'm working in the team of Professor Dirks. Yeah, I myself, I'm not part of the team of founding mothers and fathers of the Hannover Patient University, obviously, but I have some experience, yeah, now for quite some years with that concept, and I hope I can give you an idea of what it is about and what we try to do. So yesterday, I actually had a look at the seminar's title, and it says transforming the medical model. And then I thought, what would it actually mean in our case, in the case of Hannover Patient University? And when we began in 2006, the fact that there was no such initiative before, well, this may give some idea that it could be necessary to do it. And yeah, our idea was to maybe not transform the medical model, but at least to transfer medical knowledge and all that research stuff that is within the university to a wider audience. So that's what we basically aimed at, and plus the fact that there are considerable efforts recently towards these things like empowerment and health education, participation, and et cetera, which is another pointer that there is maybe some relevance attached to a concept like this. And to start with this, our idea was to transfer medical and health knowledge, of course, to a wider audience. And that's actually the last point on this slide, but there was a role model for us, which was the Medical School that was already initiated in 1998 in the University of Colorado. So slightly later in 2006, we decided to adapt this concept or use it for our own purpose. And we had some kind of key features, key principles underlying this idea. So first of all, it should be independent to everyone, and you can always have a discussion about whether it's really open to everyone or if everyone really participates. It should be, or it is, financed only by our own funds, funds by Hannover Medical School, so we are independent of any other interests. And we do rely on quite a broad range of commitments by all those working for Hannover Medical School, and of course a network of regional and national supporters. We do want to provide knowledge about health and healthcare and all these things, make university research findings available. But behind this, there's that more general idea to contribute to things like empowerment, health literacy. Of course, we want to promote self-management. For instance, for people who have a chronic disease. And that's the one side. And the other is that many experts within university who do complex health and medical research would want to take a look at, or closer look at patient orientation and know how to spread knowledge to a wider audience. So that's another thing for us we wanted to achieve. Teaching formats, if we want to contribute to things like self-management and empowerment and so on, it might not be good or sufficient to only do written information or lecture series and this kind of stuff. And it does receive some attention on this slide, maybe too much, but we do many different things except for lecture series. We offer various seminars in different places. We go to schools and companies, for instance, to have specific events on certain topics. And for instance, we've done ethics university on regenerative medicine in the past, so looking at issues that have quite some societal impact today. There's another thing called arts and disease, where we look at the disease of famous artists, actually. That relates to the teaching formats as well, didactics. As I said, we don't only want to provide written information or do lecture series or whatever, but the idea is to have a more interactive dialogue with those who are our visitors. And we do this by encouraging exchange, stimulating active information behavior, these things. What is maybe one or the most important aspect is our tutor system. And you see on the picture, these are medical students or public health students who, in addition to an introductory lecture that is always given for those big general events, so where visitors have a chance to look at a specific topic, and this could be whatever you could think of, basically, and to have a more direct chat with the students and ask questions and everything. And that we do at what we call learning stations. So that's basically how one of the main events, health education for everyone, could look like. So first, there is a general presentation by an expert, which is usually a professor, who gives a kind of broad introduction to one of those topics that we look at. And then, as I said, there's an opportunity for further discussion and exchange at the learning stations. And when you look at the pictures, I see, well, you probably have an idea what it's about. And there's an example for this on the next slide. So we try to actually cover a whole range of topics during one event. And this could be medical issues, of course, physiology, diagnostics. But of course, we also, as I said, aiming for empowerment, health literacy, and so on. There are different issues, of course, prevention and patients' rights, how to find information, how to ask questions. That's what we want to discuss with our visitors as well, because it wouldn't make too much sense to be only very descriptive, I think. So there are all kinds of different things that our visitors can do and use information. And the idea, and I hope this is clear in general, is to organize all these different learning formats along the current understanding of health literacy, actually. So we don't only want people to be able to find or search for information, but we also want them to be able to talk about it, to reflect their ideas or opinions, and then, of course, apply it in their daily living. And that's how we arrange for those different topics and try to integrate all of these aspects in an event. If we go to the next slide, then we've done all kinds of assessments on the concept of Hannover Patient University. This one is a bit outdated, I think, but the statistics or the figures haven't really changed. So if we ask people what they think about it or how they feel about being part of it, then we do receive answers like this. I've increased my knowledge, my general knowledge in health. I can deal with my own disease better, or I have more or better navigation skills, for instance. People who have a positive attitude towards this, they say things like, I'm more self-confident, which is good for us to know. I've become more attentive and courageous. I'm able to argue more soundly and forcefully. And of course, these things can always be improved. On the last slide, there was a figure saying that 22% of those, or if you can go one back, that one, 22%, so 1 in 5 participants acts more confidently in contact with health professionals. And you can argue if this is good or if there needs to be improvement, but it's maybe not a too easy kind of skill to be on eye level with an expert and be able to talk to these people. So that's an achievement already, but I guess we can do better. Where are we now in 2021? Well, there are all these statistics. By now we have quite some experience, 14 or even 15 years, many events and learning stations and all these things. What is maybe more important than this, I'd say, is that the concept was adapted by other institutions, for instance, University Medical Center in Hamburg. But it's not only that, as I said in the beginning, we were able to also go to schools and companies and discuss with the people there about their questions. And that's, I think, in terms of transformation, one important aspect to not only stay within university, but also try to reach people actually where they are. Patient University in pandemic times. Since 1 year, it's not possible for us to do this format in a way we've done it so far. So we thought about what we could still do, and in the end, it's what many institutions try to do, or what they have already done so far, and that's creating some kind of online concept. Yeah, we try to stick to or be as close as possible to our actual format. We do offer, when there's an event that is recorded, a first video, which is again an introductory or an overview of that specific topic. And there are different ones. Some are suggested here. We had tinnitus already, heart failure, COVID-19 and vaccination. That was a subject we discussed already. And then there's a chance after this to submit questions to the expert. And then in a second step or in a second video, these things are answered, or experts try to answer the questions from the audience. And it can't be obviously in a way so interactive as is our actual format when we meet in Hannover. But that's at least a way of how we can do it. And we see that it's actually many people looking for these services. We had about 39,000 hits of the website in general, and the various services that are attached to it. That's our website, where we basically, it has an important function, or even a more important function now than it had before. Because of course we try to, when we can't meet in Hannover with all those people, put as much knowledge as we have on that site. It's not yet available in English, unfortunately. We could discuss if this would make sense in the future. Right now we're kind of busy with actually updating all the information on our website and making it available more than it was before, because obviously now a website service is used much more than when it was when people actually had a chance to visit us in Hannover. We try to be up to date. We try to, and not only bore people with long written texts and everything, but use some short videos instead. And I hope that's similar or in accordance with the idea of portraying medical information in a way that is appropriate in 2021. This was a short overview of Hannover Patient University. Pictures like these aren't possible at the moment, but maybe you have a bit of an idea also what the team is and how they are. We hope that this will be possible again in some time. And for the moment, we can only show these kind of pictures in seminars like these.
Thank you very much, Jonas.